Hi, I'm Dr. Alycia Policani, and I am a naturopathic physician. I have a primary care practice in Spokane, Washington, and I have an emphasis on women's health and thyroid issues. And what I love most about the Dutch is the ease of use and its accuracy. Since I've started using Dutch, I have been getting much better clinical outcomes. So I'm a Dutch user for life.
What inspired you to become a healthcare practitioner?
Well, I was in my second year of university, and somehow I snuck into the last anatomy and physiology class of a 3-semester series without taking the first 2 classes in the series. This class had anatomy dissection, and I know it sounds gruesome, but I was fascinated and completely fell in love and amazement with the complexity of the human body. My plan was to be a chemistry major prior to taking that class. But after that, I changed my major to human biology and planned to become a medical doctor. I had no idea that naturopathic medicine existed at that point, but at the end of my 3rd year of university, Bastyr, which is one of the naturopathic medical schools, came and gave a 1-hour presentation. And my best friend at the time in the biology program was planning on becoming a chiropractor, so she dragged me over to hear Bastyr's talk. And as soon as I learned about naturopathic medicine, I just knew that that's what I was meant to do, and so I did it.
So where did you go to school specifically?
I went to school at what's now called National University of Natural Medicine. It was National College of Naturopathic Medicine when I attended. And I'm a licensed naturopathic physician. So to apply to naturopathic medical school at least 24 years ago when I started, you needed to have a bachelor's degree and several science prerequisites. So I have my bachelor's of science in human biology from Eastern Washington University, and then 4 years of post-grad naturopathic medical training from NUNM.
So what is your current practice?
My current practice, well, I've been in practice now for 20 years, and I have a private practice in Spokane. I function mainly as a primary care physician, but over the past few years, I've been really trying to concentrate and specialize on women's health and thyroid issues.
And do you use any other functional testing in your practice?
I do. I use the Dutch Complete most often. Definitely that test was a game changer for female hormone balancing and adrenal health. I used saliva testing prior, but again, like I said, I feel like I get much more accurate, consistent results with the Dutch. I've used a variety of functional testing over the years. What we're currently using in clinic right now are the Dutch tests. We also use the BiomeFX stool panel by Microbiome Labs. We use the Great Plains oat and mycotox panels, and for our allergy testing panels, we use ELISA Act Biotechnologies. We all do a lot with MTHFR, and so we use Stratagene testing. Of course, standard blood test, as well as blood tests for certain nutrient deficiencies. We also have a doc in clinic who treats Lyme disease, so he uses a lot of blood and IGeneX functional testing for Lyme and co-infections.
And then what would you say the biggest changes you've seen in your patients and your practice since you started incorporating the Dutch test?
Well, I first came across Precision Analytical and the Dutch panel at the Hawaii Doc Talks about 5 or 6 years ago. So Dr. Carrie Jones was at the booth, and just looking at the information and the research behind the testing method, I was just so excited. I went home from the conference and just immediately changed all of my hormone and adrenal testing over to the Dutch panels. Dr. Jones is amazing, and she provides such great clinical support to the physicians, and she really taught me how to, interpret a lot of the testing. I've taken 2 or 3 of the training seminars that were offered by Dutch since then, and I have just seen greatly improved patient response, and I feel like I'm getting a lot better clinical accuracy with any of the recommendations that I'm making for hormone balancing and for adrenal health since I started using Dutch.
How would you say that it's like generally impacted your women's health?
I would say that how it's generally impacted them is that it's, improved their quality of life. I see a lot of perimenopausal and postmenopausal women and, sleep issues and hot flashes and night sweats and, mental emotional imbalance, anxiety and joint pain and all these things that unfortunately our mothers never told us came along with perimenopause and menopause. And it really impacts their quality of life, and having a tool that gives me really great clinical data so then I can move forward with a treatment plan to help balance that out. They can start sleeping again, they can think again, just makes a huge difference to them.
So do you use Dutch as a baseline, and do you do any follow-up testing?
I actually do both regularly. It's important to me to have a baseline before starting a patient on a plan because I feel with hormones it's all about balance, and sometimes the symptoms that are associated with certain hormone balances overlap. So I really like to be sure of my path at the beginning of the journey. So I'll start with baseline, and then depending on how patients are responding, I might follow up at 3, 6, or 12 months, depending on how they're doing. If they're doing great, then I will probably follow up once a year. If they're having a hard time, I'll probably do it every 3 months until I get it dialed in.
Are you practicing more virtually than you were previously?
Definitely, especially March through June of last year. We've instituted several protocols to keep our clinic as safe of a space as possible. And really since June, we've been seeing more patients in clinic because they just hate the virtual platform. They really do. But I'm still doing quite a bit more virtual than I have done in my past 20 years of practice.
Do you have any patients outside of Washington, or?
I have patients, yes I do. I have a lot of patients that winter in other places, and so they'll check in while they're in Arizona or other spots.
So where do you see functional and integrative medicine heading 20 years from now?
I'm hoping it'll become the norm, the standard of care in our country. I've seen an ever-growing movement of patients asking, demanding for this type of care. People are just really tired of the conveyor belt, one-size-fits-all medicine in which, maybe they get 5 minutes of the doctor's time. They really want whole person care, and they should want and demand that type of care. It's the type of care that prevents costly chronic diseases, and it promotes optimal wellness. So we only get to do this life once, and we need to make the best of it.
So is there anything that you like to do outside of work?
I'm pretty ADD about my activities. I love to garden, I love to cook, I build stuff out of wood like furniture and garden stuff. I like to ride my horse, I hike, I ski, I paddleboard. Like I said, I'm a little ADD about my hobbies.